Hello everyone. In this video, we will be studying about plasma cell disorders. So, plasma cell disorders basically here lab serum protein electrophoresis and urine protein electrophoresis are carried out. And the most important disorder in plasma cell is multiple myeloma. What we will see, M spike we will see on the protein electrophoresis. Now, studying about multiple myeloma. Here, clinical features are CRAB. Okay, CRAB is hypercalcemia. C for hypercalcemia, R for renal involvement, A for anemia, and B for bone lytic lesions. So, hypercalcemia is due to increased secretion of cytokines, that is interleukin 1, TNF alpha, and rank ligand, and increased osteoclast activity. Osteoclast, that is bone destroying cells, will be more. So, metastatic calcification will occur, osteoporosis will occur. Then, renal involvement. Renal involvement, Fanconi anemia can occur, and decreased anion gap. M component. M component is positive and it retains the chloride ion. So, chloride ion. We know the formula for an ion gap. It is the chloride ion and the bicarbonate ion are minus or subtracted from the sodium ion. So, if chloride is retained, then the ion gap will decrease and anemia will occur and bone lytic lesions. Bone lytic lesion, punched out lesion on X ray, and the most common site is vertebra. Vertebra less than ribs, less than vertebra, then more than ribs, more than skull, more than pelvis. Bone scan, lytic lesion are there. As we have discussed in the video on tumors, the bone scan will be less useful. Peripheral blood smear will show Rolex formation. Urine analysis show Ig light chain, also known as Bernstone protein with negative urine dipstick. And bone marrow analysis show more than 10% monoclonal plasma cells with clock phase chromatin and intracytoplasmic inclusion containing IgG. Then complication. Complication increased infection risk. Most common infection is pneumonia and pyelonephritis, and most common pathogen is strep pneumoniae. As it is with the immunocompromised, the capsulated organisms that will be more common. Okay, strep pneumoniae and staph aureus that can happen, and primary amyloidosis can happen due to beta 2 microglobulin. Beta 2 microglobulin, most important, poor prognosis. Now let's see the images. These are the classical puncture out lesion, then Rolex formation, clock face, chromatin. In Waldenstrom microglobinemia, it is not that important, but we need to remember is hyperviscosity syndrome occurs, headache, blurry vision, Raynaud's phenomenon, retinal hemorrhages, and peripheral neuropathy can occur. Then now we see what is the WHO criteria or the definitions for the multiple myeloma. Multiple myeloma, bone marrow monoclonal plasma cells, more than 10%, and one of the following myeloma defining events. Evidence of end organ damage, that is CRAB, and biomarker for malignancy. Bone marrow plasma cells. Bone marrow plasma cells more than 60%, more than one focal lesion on MRI, and kappa is equal to 100 into lambda, or lambda is equals to 100 into kappa, means one of the chains is 100 times the other chain. So this is the criteria for the multiple myeloma. बोन मैरो में 10% से ज़्यादा होना चाहिए और उसके साथ एक और चीज़ होनी चाहिए. यहाँ तो बोन मैरो में ही मोनोक्लोनल प्लाज्मा सेल है वो 60% से ज़्यादा हो जाए, या फिर क्या है फोकल लीजन MRI पे हो, या फिर काप्पा इक्वल्स टू 100 इंटू लैम्डा और लैम्डा इक्वल्स टू 100 इंटू काप्पा हो, या फिर क्या है क्रैब क्राइटेरिया. Either of the two should be present. Then, what is plasma cell leukemia? Leukemia means in the peripheral blood it has gone. So, here not the bone marrow monoclonal cells we will be counting. Here we will be considering the peripheral blood plasma cells. Peripheral blood monoclonal plasma cells more than 20%. Okay, not 10, more than 10%. Here, for the blood we need 20% cells. Then, smoldering or asymptomatic. Smoldering or asymptomatic means here the myeloma defining events, that is CRAB criteria is absent and either one of the following should be there. मीन्स सिम्टम्स नहीं है, क्रैब क्राइटेरिया नहीं है, बट एम प्रोटीन्स इंक्रीज्ड हैं कि मल्टीपल मालूम है एम प्रोटीन्स विल बी इंक्रीज्ड आइदर मोर देन 30 ग्राम पर लीटर और मोर देन 3 ग्राम पर डेसीलीटर इन ब्लड एंड more than 500 milligram, means half a gram per 24 hour in urine, either 3 gram in the blood or half a gram in the urine. एंड बोन मैरो प्लाज्मा सेल्स मोनोक्लोनल प्लाज्मा सेल्स इससे कम होने चाहिए। मैक्सिमम कौन सा था? 60% था। तो स्मॉल्डरिंग है एसिम्टोमेटिक उसमें 10 to 60%, नॉट मोर देन 60%। एंड देन अनदर entity is non-secretory multiple myeloma. Here no M proteins are present. So these four things we need to remember: multiple myeloma, then plasma cell leukemia, smoldering, and the non-secretory multiple myeloma. Now let's see little about myelodysplastic syndrome. Myelodysplastic is stem cell disorders, ineffective hematopoiesis, and it may be due to radiation, benzene, chemotherapy. And what is the classical pseudo Pelger Hewitt anomaly? Hewitt is replaced by Dewitt. Okay, so Dewitt nuclei will be there. Here the neutrophils with bilobe nucleus will be present, and immunosuppressants. Here it is seen. This pseudo Pelger Hewitt anomaly is seen in myelodysplastic syndrome and also seen with the drugs, immunosuppressant. So that is all what we need to remember about the plasma cell disorders. I hope you will find it useful. If you like my content, please do subscribe my channel. Thank you.